Air is more than background. It sculpts our moods, memory, sleep, and attention. This film explores how air shapes the human brain. We call air the atmospheric architect because invisible currents and chemical blends influence neural activity at every scale from cells to networks. Over 5 minutes, we move through history, science, and lived experience to reveal how modern environments rewrite ancient biological rhythms. Measured ambient sound will thread the narrative while subtle motifs underscore discoveries and moments of revelation. Listen closely. The air in this room or garden carries signals that alter brain chemistry, neural timing, and the architecture of thought. We begin with a familiar frustration, the mid-afternoon slump, and the tight, sealed spaces that seem to cloud our minds. Modern life keeps us indoors about 90% of the time, a dramatic shift from our evolutionary past. This shift created what researchers call an invisible ceiling on cognition, sleep, and long-term health. We notice it in simple ways: afternoon droop, poor sleep after long nights indoors, headaches in sealed conference rooms. Often we blame caffeine or circadian drift, yet air chemistry, rising carbon dioxide, stale particles, low microbial diversity plays a central role. Indoor environments concentrate pollutants and mute natural signals, like breezes, scents, and microbial cues linked to brain development. Understanding that relationship reframes architecture and health as contiguous sciences rather than separate concerns. In the 19th century, public health reformers confronted collapsing cities and lethal epidemics with bold urban interventions. The sanitary movement promoted ventilation, clean water, and sewer networks to purge what they called miasma, bad air. Leaders like Edwin Chadwick argued that urban design could prevent disease by reshaping the atmosphere of cities. Their ideas mixed observation with limited science, yet they established an enduring principle: air quality is a public good. A century later, sealed buildings and mechanical ventilation transformed living and working spaces in new directions. We now revisit those lessons with modern tools, sensors, epidemiology, and neuroscience to measure how air affects brains directly. At a cellular level, pollutants trigger inflammation and oxidative stress that alter synapses and neuronal signaling. Carbon dioxide accumulation slows cognitive processing and reduces decision-making speed in poorly ventilated rooms. Fine particles penetrate lungs and circulate to the brain, crossing barriers once thought impermeable. Nature exposure delivers different signals: plant volatile compounds, diverse microbes, and dynamic airflows that tune neural circuits. Studies link green space access to improved attention, reduced anxiety, better sleep, and measurable brain connectivity changes. Diagrams show how airflow patterns, pollutant gradients, and natural ventilation shape oxygen delivery and neural microenvironments. We profile workplaces and schools that reclaimed air through simple measures: increased ventilation, plants, and time outdoors. Case studies reveal cognitive gains, fewer sick days, and improved sleep when buildings prioritize breathable design. Biophilic design and policy shifts can restore natural cues inside cities without sacrificing efficiency or comfort. At home, small changes matter: open windows, houseplants, air purifiers, and outdoor routines reshape daily exposure. Policy matters too. Building codes, urban trees, and public health campaigns can scale benefits across communities. We end with a simple proposition: design the air, and you design the mind. That is the work before us.